Hello, and welcome to MediByte. I'm your host, and as a healthcare professional, I'm here to help make complex medical topics simple. Today, we're diving into a test that you might hear about during pregnancy, one that can bring up a lot of questions: amniocentesis. We're going to break down what it is, why it's done, and what you can really learn from it. Pregnancy is just this incredible journey, right? But it's also filled with so much excitement and, let's be honest, a ton of questions. You're constantly wondering, sometimes you worry, and all you really want are some clear answers about how your baby is doing. Well, that's where a certain kind of test can come in, one that can actually provide some of those definitive answers. It's called an amniocentesis. So let's get right into it. What exactly is this test?
Okay, so at its core, amniocentesis is a test that looks at the amniotic fluid. This is the fluid that surrounds and protects your baby inside the womb. And what's so amazing about this fluid is that it contains cells that your baby has actually shed, cells that hold a literal treasure trove of genetic information. Now, here's a really, really critical point to understand. A lot of the prenatal tests you might get are what we call screenings. They just tell you the chance or the likelihood of a problem. Amniocentesis is totally different. It's a diagnostic test, which means it's designed to give you a definite yes or no answer, and with an incredibly high degree of accuracy. So what kind of yes or no answers can it provide? Well, this test can diagnose a whole range of specific conditions. We're talking about chromosomal disorders like Down syndrome, genetic diseases like cystic fibrosis or sickle cell, and even issues with how the baby is forming, like neural tube defects. Spina bifida is a common example of that. Okay, so that leads to the next logical question, right? If this test gives so much information, who is it usually offered to? Let's take a look at the factors that might lead your doctor to bring it up. So, a provider might suggest an amnio if certain things are going on. For instance, if you're 35 or older, or if a previous screening test came back with a result that flagged a potential issue. Other reasons could be a family history of a specific genetic disorder, or if you've had a child before with a birth defect. But it's so important to remember, even if it's offered, the decision to have the test is always, always yours. All right, so let's say you and your provider decide this test is the right path for you. What actually happens? Knowing the steps ahead of time can honestly make a huge difference in reducing any anxiety you might be feeling. The procedure itself is actually pretty quick and straightforward. First, you'll just lie comfortably on an exam table. They'll use an ultrasound to get a good look and find the perfect, safest spot for the test, away from the baby and the placenta. After they clean the area on your belly, a very thin needle is used to draw out a small sample of the amniotic fluid. And right after it's done, they check on the baby's heartbeat again with the ultrasound, just to make sure everything looks great. And honestly, one of the most reassuring things for many people is just how fast it is. I mean, you might be at the office for a little while, but the actual part where they take the sample, from start to finish, it's surprisingly quick, usually only taking about 15 minutes. Of course, with any medical procedure, it is absolutely essential to have a clear, factual look at any potential risks. So let's talk about that. Let's start with the biggest concern that's on most people's minds: miscarriage. Because of modern technology, especially the use of continuous ultrasound guidance, the risk of the procedure itself causing a miscarriage is very, very low. The data consistently shows that risk is less than 1%. It's a real consideration for sure, but it's so important to ground that concern with the actual statistic. Now, what's much more common is to experience some mild, temporary side effects afterwards. You might feel some light cramping, maybe see a tiny bit of spotting, or notice a small leak of amniotic fluid. Your provider will give you a clear list of what to watch for, like any significant bleeding or a fever that you should call them about right away. So after the procedure is over and you've had a chance to rest, the next phase is waiting for and then making sense of the results. What do they actually tell you? The results usually come back in a pretty clear way. A negative or normal result means that it's extremely unlikely that your baby has the specific condition they tested for. On the flip side, a positive or abnormal result means it's very likely that your baby does have that condition. It's direct, which, is the whole point of a diagnostic test. And this is just so crucial to hear. You do not have to figure all this out on your own. Whether a result is abnormal, or even if you just have questions about a normal one, there is support. Genetic counselors are professionals who are specially trained to help you walk through the results and really understand what they mean for you and your family. So what's the big takeaway here?
Well, the whole purpose of an amniocentesis is to give you clear, accurate information. That information is power. It empowers you and your healthcare team to make the most informed choices possible for your health, your pregnancy, and your family's future. And really, that just gets to the heart of everything. It really makes you stop and think, doesn't it? How much of a difference can clear, accurate information make on any of our health journeys? It can change everything. Thank you so much for joining me today. I really hope you found this helpful. For more clear and reliable health explainers just like this one, be sure to like, share, and subscribe to the MediByte channel. Stay informed, and we'll see you in the next one.